At BWC, traction application is always a two-person procedure, one of whom must be signed off as competent. For Gallows traction, both legs require adhesive traction, starting with the affected leg. For the purposes of demonstration only, this video has one nurse and only one leg in adhesive traction. In practice, please apply adhesive traction to both legs with a second practitioner to support.
For this part, you'll need to loosen the end of the attachments and slide the bar so it sits above the patient's hip level. And then make sure you re-secure. So once your patient is in the suitable position with the bar that sits above the hip level, you're ready to put the child in traction. So again, you need your colleague just to support the other leg, and you do one leg at a time. Ideally with the affected side first. So you will have your two cords, and these are your pulleys that sit above the child's hip level. So you've got two cords. One you apply over one side. So at this point, while you're doing this, your colleague would be then supporting the child's leg. So one cord will go over one side, and your additional cord goes over the other side. This then allows you to be able to pull your child into the correct position. You can secure both your knots. So tie it underneath and around. You will have additional string, but it's always good to keep the string and not to cut it, because throughout the child's time in traction you will be frequently adjusting the suspension due to the child's mobility. So once you've secured your knots, you can just discard your extra string up here, again out of your child's reach for safety reasons, but also so you've got it to use when you need to resuspend the child in traction later on. And it's also out of the child's reach. You can secure that on the top of your cot with some tape. Once both your legs are suspended in traction, this is when you do just a full check to make sure you are happy and that the bottom is raised off the bed. So essentially the child's weight is pulling down this way and against the traction suspension above the bed. This is where your correct alignment will take place. Once the child is suspended in traction, you will find they will be much more comfortable because the leg will be in alignment and the patient should then be more comfortable. But always make sure you are giving regular analgesia, particularly for the first few days. So CSM monitoring is also essential with your children in Gallows traction. When you first put the child in traction, you might note that the foot will be a little bit cooler. That's just because the blood has to work a little bit harder to get up the body. Once you find the child is a little bit more mobile and they're starting to flex the foot a bit more, your foot will generally warm up, but you can apply some socks or some little boots or something over there just to keep the child warm, or a blanket. But just make sure that your child has good movement from the foot and the toes, good sensation, and you've got a good circulation by looking at the warmth of the foot as well, and escalate any concerns to your colleagues. You would also make sure that you are palpating the pulse as well on the dorsum of the foot. The other important consideration for a child in Gallows traction is the nutritional status, because obviously good nutrition will promote the bone healing. Quite often children in Gallows traction are obviously very small, so they could be potentially breastfed, so it's important to ensure we are supporting the mums when they are breastfeeding. A good diet, a high calcium diet, is very important. If you have any concerns with the child's intake, you could involve the dietitian to ensure supplements if necessary, but just make sure you are documenting accurately the intake and the output of the child so that you can highlight any concerns at the earliest opportunity. Any concerns throughout the child's admission regarding CSMs, neurovascular status, diet and fluid intake, so nutritional status, or the condition of the child's skin, tissue viability, ensure you escalate to the nurse in charge for the first port of call, who then can assess the situation and escalate it further to the team involved if necessary.
Gallows traction summary. Follow the video guidance for adhesive traction. Align the traction bar to the patient hips. Elevate the affected leg first, ensuring the hips are flexed at 90 degrees and a flat hand can be passed underneath the patient's bottom. Pass one traction cord through the pulley and the second cord the other way through the same pulley. Check the patient position before securing the cords with the knots. Repeat for the other leg and then follow the ongoing traction care guidance. Ongoing management. Observe and record PU scores and neurovascular observations as per the Trust policy. Monitor pain scores regularly and administer prescribed analgesia. Check the adhesive traction daily, removing the bandages, to check for tissue viability and to wash the skin. Monitor the position of the traction and adjust if required. Ensure adequate nutrition and hydration, maintain accurate fluid balance and escalate any concerns regarding constipation.